Thank you so much. Good morning, HOB. I'd like to take this opportunity to just give you clarification. I know you've heard so much about this corona, but I'm going to give you important points that I believe it will help each and every one of us to protect ourselves and also our loved ones. So I'll start just by explaining on what exactly is this corona. So you'll hear the word COVID-19. This basically means, it's an abbreviation that means coronavirus disease 2019. So that's just a medical abbreviation for the disease. So what exactly is this coronavirus? So it's an infectious respiratory disease. That is to say that it's a disease that attacks our airway or breathing system. And the cause that has been established so far from the various researches that have been done in the few months of the outbreak is that the source is a new strain of coronavirus. So this coronavirus, it has been there and has caused virus outbreaks before. But what is happening now, it's seen that the culprit is a new strain of the coronavirus, and it's named by that long abbreviation, which you don't really need to know. So with the aspect of transmission, how exactly can one get this infection? So the main things that have been established from the World Health Organization is that the virus comes from animals. So what has been speculated so far is that it's from the animals in China, and now it has passed on to humans. So what is happening is that now there's what we call person-to-person transmission. And how can one get? This is only possible through what we call droplets. So we call it a droplet disease in the sense that it can only be passed through a droplet attaching to what we call the mucous membrane, which are either in your mouth, in your nose, or the eyes. So the means would be if I'm in close contact with someone who is coughing or sneezing and passes on the droplets to my eyes or to my nose or my nose or mouth. So if it's in a close contact. But another means would be now, because these droplets have a limitation in the aspect of the distance it travels. So if I'm not in the close contact, what would happen is that these droplets would fall. So they're like a heavy kind of virus. So it would fall down on the surfaces or objects. So if the viral droplets are on these surfaces and objects for a while, and you come into contact on these surfaces and objects, then the person who is not infected and touches these objects, and then with these contaminated hands, they touch their mouth, their nose, or the nose, the mouth, and the eyes, then the virus can access their bodies. So it's only through these means. So it's a droplet, infection, right? So those are the main two means that have been established so far by the World Health Organization. So in the PowerPoint, I've just included that the access points are the eyes, nose, and mouth. And this infection, it has what we call an incubation period. It's 2 to 14 days. So incubation period basically means that once you get the virus, it's not necessary that you develop the symptoms of the virus right away. So it might take 2 to 14 days before a person who is infected with the virus to manifest the symptoms. So you can be infected, no symptoms at all, but you are infectious. You can be having a minor symptom such as just a dry cough. But if you are releasing those droplets, that's when you're infectious. But if you're not releasing those droplets, then you're not infectious to another person who is not affected. With regard to the symptoms of this COVID-19, the main three symptoms that have been established so far are fever. So a person who is infected after these 2 to 14 days range, they may present with fever, they may present with a cough. And the nature of the cough is usually a dry cough, not the one which produces mucus. So some people might have that, but the common presentation is that it has a dry cough. Another presentation is that a person may have difficulty in breathing or shortness of breath. So those are the 3 major symptoms. But in relation to this, other people may present, in addition to the three, is body weakness or pain, a runny nose, sore throat, or a headache, or any kind of pain in their body. So there's a discomfort because of the virus being present in their bodies. So the important point now is, how do we prevent ourselves from this virus? From the many researches that the World Health Organization is doing so far, the important aspect that has been established that this is actually an effective way to prevent this virus from spreading to many people is the proper hand washing technique. And this proper hand washing has to be done with soap and water. And not just with soap and water, but it has to be done in the minimum time of 30 to 40 seconds. So this is emphasized because this virus, the nature of the virus, it takes time for the soap to break it out, to destroy it, and to eliminate it from our hands. So it's not a matter of just simply putting your hands in a running water without soap. That will not work. The virus can continue staying on the hands. It's not a matter of just putting the soap there, but it has to be really go through the friction movements of the hands to be able to eliminate the virus. So at the end of this presentation, I'll just demonstrate the proper steps that the World Health Organization is advising all of us to follow in this time of this pandemic in washing our hands. So actually, we have to learn new steps and exercise this at all times for this now hand washing technique to actually work. So in the aspect where now we do not have hand washing facilities, what can one do? This is where now the famous sanitizers are coming in. So if there's no facilities of hand washing, because now hand washing is the number one thing to prevent, but if it happens now I'm in a facility where I cannot do the hand washing, then the hand sanitizers come in. But now the researches that are done on this virus say that the only kind of to be effective is 60% of alcohol. So the World Health Organization says it has to be an alcohol-based sanitizer that is 60% or more to be able to work. And the same technique that comes with the hand washing, it has to be done with the sanitizers. So the sanitizers also has to be used with a good quantity, not using it in the fear that it will finish. Otherwise, you'll not be doing something that is effective. It has to be a good amount on both surfaces of the hands and also following the hand washing technique that I'll demonstrate at the end. So those are the two main ways of protecting ourselves from the virus. But what if it happens now, those two means now have not worked and now the virus is on my hand? One way I can prevent the virus from accessing my body is not to touch my 3 access points, of which we said is the eyes, is the nose, and the mouth. So the virus can be on my hands, but as long as I don't touch my eyes, I don't touch my nose, I don't touch my mouth, then the virus cannot have of these 3 access points until we are able to deal with this pandemic. Other additional points that now can help is staying well hydrated and eating healthy foods. So actually this point, it's not specific for the coronavirus, no. This is something that we're actually supposed to do as individuals. But now it is not strong, then it will determine where you fall in the 3 groups of people that are affected. So it will determine whether you have a mild infection, a severe infection, or you'll be amongst the critical people. So it's very important now at this time to keep healthy. The vegetables, the fruits, the lots of water, now it has to be a habit. Apart from that now, because we have said now, if the virus does not access your body in that close contact with an infected person, these viruses will eventually just fall on the surfaces objects are around. So we need these viruses can actually thrive on these surfaces or objects for a period of hours, and some objects like plastic and glass can even go to a number of days, like an average of 3 to 5 days. So we need to do proper cleaning of the surfaces of these objects with disinfectants, or if you don't have disinfectants, the best weapon right now is just soap and water. So any soap has been proven that it can actually kill this virus. So we need to do the regular cleaning of the surfaces and objects. So in the next slide, it's a time at our homes, in places like doorknobs and tables where we know that frequently we are touching with our hands. We clean this to ensure that the virus does not thrive on that surface. Another preventive measure would be avoiding unnecessary crowds and unnecessary traveling of this at this time. So we know many countries have been affected by this, and even many countries coughs on you, then those are dangerous crowds at this time. So if it is possible, avoid such crowds. If it is not, just take more precaution to prevent yourself. Now that you know the virus can enter through the means of nose, mouth, and eyes, and my hands are useful in introducing this, then you can take care of yourself through those ways. Another thing now that we need to practice at this time is to cover ourselves, our mouth and nose, either with a tissue. If you have a tissue, it will actually be best. You from infecting the next person, or even just releasing the droplets on the surfaces around. So you're protecting other people around you. We're not saying that everyone who's coughing or sneezing right now has the coronavirus, but because now we don't have everyone tested, so it's a safe measure for everyone to take. That if you're either not sneezing on the tissue, then you can just sneeze on your elbow. This way, when you do it on your elbow, you're actually preventing it from the droplets from being on your hands, and hence from you either touching your 3 access points or even giving it to another person through a handshake. So handshakes right now, actually, one thing we should avoid, because if someone has the droplets, the viral droplets in their hands, they can pass it on your hands. And if you're not careful, you can introduce it to your body. Lastly, on the prevention, the Ministry of Health has actually given out numbers that we can contact them in case we see or we feel the common flu, or some people can even have a fever because of a malaria, but because now we're in a pandemic, then the corona should also be on top of our minds. So how do we treat this disease? With all that has been done so far, the researches and everything, so far we have no treatment. So there's no cure. The person presents presents with. So you come with a fever, we treat the fever, the pain, we treat the pain, we support the breathing if you cannot breathe on your own. So it's what we call a supportive treatment. No cure, no vaccine, unless it's discovered in the coming days. So one thing we should avoid, there has been reports of these two drugs. I just like to touch on them: ibuprofen, or what we say brufen in our common language, and chloroquine. So ibuprofen has not really doesn't the coronavirus in our settings would react. So it's best at this time, when you have such symptoms, fever and the headaches, do not self-medicate with brufen, okay? So at most, at least take a paracetamol, but not brufen. Let a healthcare personnel prescribe it. And another drug is chloroquine. I know now it's become famous because some centers in the world have said, okay, we have seen chloroquine. Chloroquine is working with regard to the coronavirus. But remember, chloroquine is what we used for what? For the malaria. So it's probably readily available here. But it's not a drug to what? To self-medicate. This is something that should be given in a healthcare center. And so far, the World Health Organization is not saying that it's a cure. Researchers are still underway. Probably they're saying it slows the virus down, but we do not know the exact doses, the exact ways it may work. And again, side effects have been observed. And unfortunately, the public, on hearing this, they want to vaccinate themselves with the chloroquine. They end up overdosing and killing themselves. So such actions can actually put you in danger even though you do not have the virus. So let's not self-medicate with any of these medications that we hear. Probably it might work, probably it might not work. Let the healthcare personnel actually do the prescriptions. Lastly, I'd love to touch on the different myths that are circulating. I know a lot. Everyone now is giving out information. Everyone is posting. So we really need to be more careful on what we hear. Otherwise, all this will just enhance more fear, and even you end up to be in a point that you cannot live thinking the virus is everywhere. So one thing that is actually scaring people right now is that transmitted through droplets. So it's a droplet disease, not an airborne disease. There's a difference. Airborne diseases, then you can get them through just the breathing, because they're able to circulate in the air for a long period. But this one is a droplet disease. So it's only through those droplets which are released either from coughing or sneezing. When they access you within that less than 1 meter distance from an infected person, or when they access you through you touching them, the access points with your contaminated hands. So those are only the means that can actually transmit this disease. So do not think that it's an airborne disease and be afraid of breathing. Breathe and take the necessary precautions. Another myth that is circulating is that actually wearing masks and actually endanger you and put you more at risk of getting the virus. Because what happens is that these masks, these gloves, there's a specific way that you have to wear them as a protective gear. But when you do not have this knowledge, then you're going to handle it just haphazardly, right? So what the World Health Organization is advising now is that let the masks, the gloves, be only for healthcare personnel, number one. Number two, let it be for those people who are sick. So it should come to a point that those who are wearing masks is only those who are sick, because now they're protecting us from getting those droplets that can be transmitted when they're sneezing or coughing. Or number three, the person who is taking care of someone who's already diagnosed with the disease, then they have reason to do what? To wear the mask or the gloves, because they're protecting themselves from those secretions. Right? So if you are doing that just at your workplace or randomly in the public place, it actually puts you at risk, because now you're putting for yourself a point, a surface, an object where this virus will just settle. So you're harboring this with your hands, with your hands with gloves, or with your mask. And then, unfortunately, most people don't even know how to properly remove the mask that is contaminated without contaminating their hands. And it gives you this freedom, a false freedom that I'm protected from this virus while you're not. So you don't wash your hands as frequently as you're supposed to, and you do not care about touching your mouth and your nose and ears. So it actually gives a false protection and puts you more at risk of the infection. So do your best, advise your loved ones, do not wear that unless you're in those 3 criteria I've mentioned. So the last myth I'll touch on is the use of vodka and spirits to make homemade sanitizers. It's understandable because now these things are in demand. The prices have just gone high. Even I am tempted. I'm like, I want to make these homemade sanitizers. But unfortunately, the information that is circulating, it's not giving us the right ingredients and right methods of doing this. So people are making things that are actually not effective. It does not have the percentage of alcohol that is sufficient to actually kill these viruses. And again, the ingredients that are used, the spirits, it's actually dangerous if not handled in the right conditions. It's flammable. Some people who are asthmatic can react to it and even get an asthmatic reaction. Some people who have skin allergies and any kind of allergy can actually react to it. So it's a dangerous act to try and make these. You are making this, you are endangering yourself, making something that is not effective and ending up with other diseases that are not necessary. And now vodka, they're saying to get 100% alcohol or ethanol. Alcohol is ethanol. 100% ethanol or alcohol containing vodka, it's very expensive. So for sure, the vodka most people have access to does not have 100%. Mostly, it's at 40%. So that means people are just using the vodka and the hand rub or the disinfectant that is assumed to be made, it's not even effective. So it's best at this time, if you cannot purchase hand sanitizers, soap and water. And the good thing, any kind of soap. So every one of us has no excuse when it comes to hand washing. So hand washing is our best tool. So with that being said, I'd just like to say we need to stay calm. I think there's one slide, media team, if you can project, on the percentage of people who have been infected so far. This was taken from China, which had the most infected people. It shows that actually 80%, 81% of the people who are infected actually have mild infection. 15% have severe infection. I think about 5% have critical infection that needs them to be hospitalized in a critical care center. So actually a large population just end up with mild infections and recover. And there's a population that is not recorded because those are the people who get the infection but do not have any symptoms at all. So there's also that population. So getting the virus is one thing, but also your immune system plays a role on whether the infection will affect you at what percentage. So most people do recover, and most people do actually suffer infection. If it happens, they get the infection. So we need to stay calm, take all necessary precautions, and above all, we need to get our information from the right sources. One thing you can do is just always check, is the information from the World Health Organization or from our Ministry of Health? Otherwise, you'll be confused with so many sources of information. Everyone will create their own page, their own stories, and put it up. If you believe anything, you can actually end up endangering your life. So let's stick on these reliable, credible sources of information at this time. So lastly, I'll just demonstrate the hand washing technique. So hand washing has to be done by, at least 30 to 40 seconds. So you can even compose your own song. Others are saying happy birthday maybe 3 or 4 times in order to know that I've actually washed my hands for the 30 or 40 seconds. But now the World Health Organization has come up with these steps in order to ensure that now all surfaces of your hands are actually covered. You are able to spread the soap on all the surfaces and eliminate the virus accordingly. So what we have to use is running water. You'll see that everywhere it says running water. So this is a safe way. So you have to be having a tap with running water and any kind of soap. So the first step would be to wet your hands. You wet your hands on the running water, and then you apply your soap. So the soap has to be applied sufficiently to make sure that it's sufficient for both surfaces of your hand. So the second step would be to rub your palms to make sure that you get enough foam. So little pov, it has to be there. You have to see the pov. The foam, sufficient, and then you rub between your palms. The third step, you now rub the back of your hands with interlacing fingers like this. And then the other hand. So each step you repeat for both hands. So this ensures that you clean the back of your hands, right? So this is the third step. The fourth step, you go a towel, tissue, I mean. If you have tissue, disposable tissue, you use the tissue, you dry, and then dispose the tissue immediately. No reusing, please. And then if you do not have tissue, you can just do the air drying. Just allow your hands to air dry. So that's the 8 steps of washing your hands. To say I've actually washed my hands effective enough to protect myself from such viruses. But if you're doing the regular, I'm done, your virus can be this side, and running water will not work on it. It can be in your tips of your fingers, ladies with the long nails. It can be hidden somewhere there, and if you're not taking care of it, then you're actually not protecting yourself. If that is really hard, then just make sure these hands do not contact your 3 access points. So they're saying even with the sanitizers, we actually have to follow these steps and make sure it covers all these. So for those who are using the sanitizers fearing the 15,000 or 20,000, you actually have to make sure it's sufficient in all surfaces. Thank you so much. That is all that we have for you.